Dr. Fonseca, to level set with our audience, can you help us understand multiple myeloma?
Happy to do so. So multiple myeloma, it's a cancer form of, the bone marrow that arises when the cells that under normal circumstances protect us by the formation of antibodies, these are called the plasma cells, they become malignant. Myeloma is the last stage of a process where, a plasma cell can go through a benign tumor or benign phase, if you may, something we call the monoclonal gammopathy, which, by the way, is quite common. About 2% of people over the age of 50 have this abnormality. So think of it like the colon polyp, a precursor condition. There's an intermediate stage that we call smoldering multiple myeloma, which is just more growth, but not quite at the level that it creates problems for the individual. And then lastly, what we just simply call multiple myeloma, and that is when the growth of those cells becomes of such magnitude that a person starts having problems or starts having symptoms related to that. These cells live predominantly inside the bones in the space we call the bone marrow, and they can do a number of things that actually lead to the symptoms and to the clinical presentation. So, as they just grow in the bone marrow, they take some of that real estate. So a person may experience fatigue, and that is because they have anemia. The myeloma cells are also very characteristic because they can erode into the structure of bones. So the destruction of bone is another feature that we see in patients with myeloma. And that can be either seen on x-rays, or sometimes people will present with symptoms related to bone pain or discomfort with movement or weight bearing. Those are signs that we look for. And lastly, the myeloma cells produce proteins, and some of the fragments of those proteins can be damaging to the kidneys. So occasionally people will present with decreased kidney function and sometimes outright failure of the kidney. So those are the common presentations. It's a disease that mostly affects people in their 70s. It's not, something that you can detect through routine testing. It's just indirectly we start seeing abnormalities, and then we do the right testing. And if anyone is hearing this, of course, they need to have the detailed discussion with their own provider.